Time is running out for millions of COVID-19 vaccine doses that will expire in just a few weeks. Health Minister Joe Phaahla says they will have to be destroyed come October. Let's discuss this further now with Wits University Health Platform Divisional Director, Professor Francois Venter, who joins us virtually from here in Johannesburg. Professor Venter, when we saw this latest news, it's been quite a while since we've had an update on where we stand in terms of COVID vaccines. Now that we have them, that number is not a small one that we're hearing. Millions of Pfizer COVID vaccines are expected to be binned if they're not used. Your reaction to that news?
No, it's just a hard number attached to what is a completely failed vaccine program. You know, it's been misstep after misstep and failed target after failed target since the start of the vaccine program. It's really disappointing. We were seeing numbers earlier this week. Sorry, we've just got into load shedding. We've just been measured up against Botswana and Mozambique, and we're behind them. You know, and it's really sad to be, to hear this news. People keep talking about vaccine hesitancy, but there's no worse hesitancy here than anywhere else.
I mean, I was thinking about it. We talk right at the start. I remember there being a conversation about there being a lack of urgency around any kind of communication plans. Firstly, with regards to what COVID-19 was and what people should be doing long before we started talking about vaccines. And that just never improved, even after we received the vaccines. I mean, I'm fully vaccinated, but I haven't received any communication about whether I should be getting a fourth dosage, when we should get it, how we should get it. There's been nothing on various social media platforms, let alone from what I've heard from those who work at grassroots levels about what's being communicated. It's as if the COVID-19 pandemic never happened. What's been your experience?
It's very, very similar to yours. It's absolutely bizarre. You know, we shut down the entire country to, for the first year, put the army on the streets, and we can't be bothered to put together a decent communication program. And it's important to remember that vaccines remain our most important line of defense. You know, all the other stuff that we did, the physical distancing and the masks and all the other stuff that we did was simply to buy us time and to prevent us at the time. We almost certainly going to have a wave in the next 6 weeks. So there is time for people to get vaccinated and to protect themselves. Almost everyone in the country has now had COVID. You know, we've got data to suggest that well over 90% of the population has been exposed. So even if you didn't get sick, and we do know that having had the infection or having had vaccination keeps you out of hospital, but we are seeing more and more data to suggest that people are still getting pretty sick, and more and more reports of this bizarre constellation of long-term symptoms, which we've kind of put into this basket called long COVID. So it's not that this virus has gone away, and it seems like government has kind of just moved on, like forgotten that it's actually existed. And to throw away, 8 million vaccines is just a shocking indictment on the program.
I mean, it does feel like it was on another planet that this all transpired, but it was the lack of a communication program. And then, of course, lest we forget, we had a corruption scandal that hit the health department right in the middle of this fight against the pandemic. And that really didn't help at the time when the health department really needed to be winning people over, winning their trust, especially when there were so many questions being asked, so much fake news out there about various vaccines as well. It was just the department was just shooting itself in the foot around every corner, wasn't it?
You stole the phrase I was going to use right there. I think what's also worrying is that these vaccines, the contracts that were signed, were signed by faceless bureaucrats, which we are under secrecy agreements, and that we don't even know who signed them. And 10 billion rand was set aside for buying these vaccines last year, which are now being binned. I remember last year being lectured by senior Department of Health officials on television, I think it was actually on your channel, telling us that they were going to be really careful with not wasting money, and that's why they were being so careful in dishing out the vaccines. And here we are destroying the vaccines. It really is disappointing. And as I said, it's not like we're being measured against rich countries. We're being measured against our neighbors who have far, far less resources. South Africa has the most expensive healthcare system on the continent, and we're way behind Mozambique. It's really it's really depressing when you start thinking about it like that.
Yeah, let me just put the numbers out there. In September of 2022, 33% of South Africa's population was fully vaccinated. That's according to Our World in Data that was quoted in this one piece. Far off the initial 70% that was the target way back when. We remember those days. By comparison, Rwanda reports 83% fully vaccinated population, Botswana at 66%, and Mozambique at 42%. I remember in the first year of lockdown speaking to health professionals, academics and research experts, especially in the field of TB and HIV, where we are leaders globally. They were screaming for government to pay attention to the success that these various programs have had in community-level, grassroots-level communication. That South Africans do not react to any fancy social media information you're putting out there. You need people from communities who are trusted to go door to door to try and convince people to get vaccinated. Those calls were never heeded, were they? And what are you hearing at grassroots level about communications about COVID-19? Is that missing in action as well?
That is completely missing in action. And again, there's no get out of jail card here for government. We've got community programs in the Eastern Cape, in some of the most under-resourced parts of the country, who have got over 90% vaccination rate. So it's possible if you just focus your attention on this. So this thing of vaccine hesitancy is just a way of blaming the public and blaming people, for what is actually just a really badly executed program. It's not too late, we've got a couple of weeks. And for the individuals out there who are umming and ahhing about this, get yourself to the nearest vaccine program. But unfortunately, this has been a failed program. And we had the expertise, we've got people who know how to do this in the TB and the HIV programs. They know how to get this stuff out. But it seems like government's just been, and to be frank, many people in the private sector who were supposed to be helping government were very overconfident in how easy this was going to be. It was not going to be easy. And then just deprioritized it this year. We were all gung-ho for 2021 and then just sort of forgot about it. And this is why we're now going to throw away these Pfizer vaccines. And watch, we've got a whole lot of J&J vaccines which are rapidly expiring. We're going to throw those away quite soon as well. It's really, it really is just such a disappointing waste.
Yeah,
and
so
it could have saved so many lives.
Indeed, 8.5 million doses of the Pfizer vaccine expected to be disposed of end of October, and then 10.1 million, which have been stockpiled, of J&J vaccine expected to expire sometime next year. Just quickly, before I let you go, Professor Venter, you did mention that you believe that there will be another COVID-19 wave in about 6 weeks' time. Talk to us very quickly about what you believe is behind that.
So this is speculation, but certainly in Gauteng, we've been almost metronomic 6 monthly waves, and if we can sort of look at that, it's usually sort of towards the tail end of October into November. The rest of the other provinces are a little bit more messy, and they come in, but every 6 months we've pretty much had a wave. So we can anticipate, sadly, around the Easter, sort of Christmas period, leading into the holiday period, that we will experience another wave. So people can anticipate this. We've got lots of these vaccines. People, it's not like government stopping us getting them. People, if they are eligible for the booster, just go and get it, as quickly as possible. That'll protect them. Now is the time to get it. In the next 2 or 3 weeks is really the time to get yourself off there and protect yourself during the festive season.
Exactly. I was about to say, your health is one thing, but if that is not important enough to you, do you want your holidays to be spoiled? Well, that's Wits University Health Platform Divisional Director, Professor Francois Venter, joining us live there from here in Johannesburg. And as you can see there, unfortunately, he is the victim of load shedding, power cuts at this time.